Dr. Mathers greeted her with a welcoming smile lit up by snow-white teeth, which stopped just short of eyes as cold as ice. "Miss Levi, welcome." He extended an immaculately manicured hand, and taking Miss Levi's, shook it gently but firmly, the reassuring handshake of a caring but confident man. He gestured to a plain yet stylish gunmetal grey plastic chair. "Please take a seat." She sat down, crossed her right leg over her left, and placed her hands on her lap, mirroring her legs, right hand cupping, almost protecting her left hand. She maintained an erect stance which might have been taken as a sign of good posture by some, but a trained observer would have recognized the telltale tells of nervous but controlled anxiety. "So how can I help you?" The smile had gone, to be replaced with a practiced mask of concern. Miss Levi could feel his cultured voice wrap comfortingly around her. "It is my fingers, Dr. Mathers. My left index finger in particular. I hate the way it looks, and feel very self-conscious about it. I know people talk when they think I can't hear. They think I can't afford to have anything done about it." She placed her hands on Dr. Mathers' desk, palms down, fingers sprayed. "See how crooked it is compared with the other fingers? My partner never actually complains, but his reproach is unspoken." Dr. Mathers took both of her hands, as if weighing them, and examined them intently. They were completely natural hands for a woman in her mid-20s. Not perfect, perhaps, but perfectly normal. But Dr. Mathers was in the perfection business. "Yes, I see what you mean. The distal and intermediate phalanges of the left digitus secundus have a pronounced inward curvature. I am sure we can help you with your problem." Miss Levi's relief was evident. She relaxed back into her chair. "I also see that the distal phalanges of your small fingers are bent slightly inward. Most people wouldn't notice, so you could probably leave them as they are." Miss Levi had not in fact noticed this before, but when she looked closely, it was clear that Dr. Mathers was correct. She wondered how she could have overlooked such obvious defects. "For the index finger, I would suggest that we mirror clone the right index finger and use that to replace the defective left one. They will then match. That is so important. It would be cheaper to use an off-the-shelf one, but while we could get a close match, it would not be perfect. How does that sound?" Miss Levi could scarcely contain herself, but she had prepared questions to ask. How long would it take till the finger heals and works fully? Will the joint be visible? Will there be any loss of feeling? Dr. Mathers put on his condescending and reassuring face. "These are common concerns. The joint will be practically invisible within 6 months. There will be a course of therapy and drug treatment after the procedure, which will last about 3 months and will help restore full functionality. There should be no loss of feeling once the nerves have fully conjoined." "You are right-handed?" Miss Levi nodded in agreement. "Excellent. Once the therapy is complete, you will have better control of that finger than you have now. The small fingers pose a different problem, but could be replaced in the same procedure. We would use off-the-shelf cultured fingers for these. We need to take some tissue samples and x-rays. Miss Khan will arrange for these to be carried out and go through our payment schemes with you." Miss Levi thanked Dr. Mathers effusively before leaving. Dr. Mathers pulled up the next patient's details to his Bionic Eyes HUD. Male, aged 54, has recently started to need to use reading glasses. Dr. Mathers smiled to himself, a genuine smile of satisfaction. He liked eye replacements. The margins were so much higher than those for routine cosmetic procedures.